and informed as we head further into the fall and winter months. Over the past few weeks, we started to see an increase in the number of COVID cases here, across the country, and in many other countries. For months, public health experts have forecasted this increase. We are going to be living with COVID until there is a vaccine or a treatment. But the Commonwealth's response to this pandemic has been transformational since last spring in nearly every aspect of our daily lives. In March and April, the medical community was still learning nearly everything about the virus. Public health experts everywhere were scrambling to understand transmission, infection rates, and to develop a medical response for testing and treatment. At the same time, states were left to coordinate strategies, often without much assistance from the federal government. Here in Massachusetts, we had serious limits on personal protective equipment and were left to fight it out with a broken global supply chain. There was essentially zero testing infrastructure available, and it was hard to quickly diagnose this new strain of coronavirus. In the absence of a public health and medical infrastructure that was prepared to deal with all of these issues, states were forced to close non-essential businesses and schools and encourage people to stay home. I've said many times that the spring felt like one long day, and that's because we were working around the clock to respond to the changing facts on the ground. We moved quickly to set up the COVID Command Center in March to coordinate our response, and our cabinet coordinated with stakeholders, speaking regularly with groups like hospital CEOs, local officials, education and business leaders, and long-term care providers. And through all of this, the people of Massachusetts showed incredible resilience and discipline. Your actions in those early days had a huge impact on slowing the virus and keeping people safe. And as we stand here in mid-October, we've been fighting COVID now for 9 months. And together, we've made tremendous progress to build a massive infrastructure to respond to this pandemic. And this progress puts us in a strong position to be prepared for whatever comes next. We're home to some of the brightest minds in healthcare and research. We've put our best people, in many cases, in charge of creating and advancing some of the nation's leading programs and resources to fight COVID-19. And we also set rules to keep residents safe as we reopened nearly all parts of our economy. For example, Massachusetts is now number 1 or number 2 in COVID tests performed per capita in the U.S. We were the first state in the nation to build out a contact tracing program. We were one of the first states to issue a statewide order for face coverings back in May. We provide on a daily and weekly basis a robust set of data and statistics to the public to track infection rates with a breakdown by community and for settings like nursing homes, child care providers, colleges and universities, and public schools. We deploy teams to high-risk communities to promote public health awareness and to step up enforcement. We maintain strict guidance for all businesses to safely reopen and have approached this in a more cautious way than many other states. We've issued hundreds of pages of guidance endorsed by the Massachusetts chapter of the American Academy of Pediatrics to safely get kids back to school to learn in a classroom. The Commonwealth has also built an army of experts to advise and fight COVID with us. And we'll bring every resource to bear in this battle to keep our residents safe and our communities intact. But there is no doubt that this virus will continue to challenge us. We've been working to get ahead of the obstacles that have been thrown in our way since last spring, and will continue to do so going forward. And as a result, we are better positioned to respond and protect Massachusetts. Last spring, we worked closely with leaders from the Commonwealth's world-renowned healthcare system to make sure our hospitals were ready for increased cases. This planning paid off. In many places across the globe, healthcare and hospital systems were overwhelmed. Not here in Massachusetts. In April, the number of COVID patients being treated in the ICU reached a maximum of 1,085. Today, there are around 80 patients in ICUs, a 90% reduction. Last spring, we saw a peak of about 4,000 patients being treated in our hospitals for COVID. Today, we have about 500 patients in our hospitals who have either tested positive for COVID or are suspected of testing positive, but the actual COVID patient census across Massachusetts hospitals these days is less than 300. That also represents a reduction of more than 90% from last spring's peak. When we reopened hospitals and ambulatory healthcare service providers, hospital systems had to attest to meeting strict capacity guidelines to make sure they were always prepared for new cases. Today, hospital occupancy statewide stands at 68%, and ICU occupancy stands at 52%. Hospitals deployed surge plans in the spring and have spent the past months refining those. The Commonwealth is now in a position to quickly expand capacity to care for more COVID patients if hospitalizations dramatically rise. If needed, at least an additional 450 ICU beds could be made available by converting existing med-surg space. In the spring, we also created temporary spaces to accommodate patients by setting up 5 alternative medical sites with the capacity to serve over 1,000 individuals. These sites are decommissioned now, but MEMA has the equipment ready to rapidly stand up if a facility is necessary. Secretary Sutters and I continue to talk to hospital leaders several times a week to track any trends they see and to make sure they're prepared for any future influx of cases. Their cooperation and ingenuity has made a huge difference in battling this virus. Now, before COVID hit, most people probably had never heard of personal protective equipment, so-called PPE. But overnight, global supply chains were disrupted, and states were left on their own to track down these critical materials. Massachusetts pursued every piece of equipment we could find and never stopped. To date, the Commonwealth has distributed over 36 million pieces of PPE, including almost 11 million gowns, nearly 11 million gloves, nearly 800,000 gowns, and over 24 million face masks to hospitals, first responders, long-term care communities, and others. We also worked with Massachusetts companies to start producing PPE here, everything from masks to gowns, and they're still in very active production. For the most part, hospitals are reporting that supply chains are back to normal, but that hasn't slowed down our efforts. We've continued to add millions of pieces of PPE to the state stockpile over the last several months, far more than we have ever had before. And based on the PPE we now have and shipments we expect later this fall, we have sufficient PPE to support emergency supply needs of healthcare and human service providers and first responders from now until the end of 2021.